enough. Okay, give punch. Where's the punch? Okay. So what I'm doing now is the first step of the hair transplant, where we try to harvest and assess the quality of the grafts and the depth of the grafts. So this is the grafts. What you see here is a root, and you can see the white filmy thing. The black one, that doesn't have life. The tissue surrounding that is a stem cells which actually produces this. So we check whether this is proper, and only then we start harvesting.
Hi, I'm here to talk about hair transplant surgery in Tamira. I'm the anesthetist here. I'm Dr. Archana. So what we do is we do give anesthesia, which is not full anesthesia. It doesn't make the patient unconscious, but we give a combination of medicines that reduce pain on the scalp and also give comfort and reduce anxiety of the patient. It also sedates the patient. They do sleep off usually. They're arousable but also comfortably sleeping. With the sedation and painkillers for the patient's comfort, what happens is when the local anesthesia is injected, the patient does not feel the injection at all or very slightly, and feels very comfortable with all the injections because it's given over the scalp, sometimes over the jaw and the supraorbital region. So all these injections are done in the first half an hour or so, and the patient is very comfortable, doesn't feel it at all, and is comfortably sleeping throughout this entire procedure. The anesthesia is given for just that duration for the first couple of hours. It wears off after that, and after that the entire surgery is maintained with local anesthesia. The patient has breakfast in about 2 hours after the starting of the surgery and is comfortable after that till evening. Finally, to sum it up, the patient is managed preoperatively, intraoperatively, and also post-operatively. In all ways, the anesthetist is available throughout. In case there are any complications post-operatively, if at all, the anesthetist is there to manage it. So in all the loopholes are closed, everything is managed, and the patient has a very comfortable and a very safe experience with a very good result.
So if you see now, I have started harvesting a beard. So in those patients whom we feel the scalp hair alone is not, donor is not sufficient, we always combine beard. When we combine beard, you can see the entire process is done in the operation theater, and the difference is the beard hair is actually usually thicker than the scalp hair, and it's the next best donor when you compare with the scalp hair. So it will also depend on both the thickness and the density of the beard hair. So in patients for whom the scalp is not sufficient, then we also use beard. So we use different punches, and we routinely do beard harvest at Tamira because we do not want to over harvest scalp alone, so that the donor area becomes visible. So how many grafts can you harvest from beard? We have harvested more than 2,500 grafts in a single individual, but it will depend on both the density as well as the angulation and placement of the grafts. Sometimes when the skin is very soft, it may not be that easy to harvest a beard graft. but by and large, and even if it's the beard hair is gray, we still can harvest them. If you choose to color after the transplant, you can still color. So the transplanted roots, you can see them that we have done a zero trim, and then they, after implantation, once they get blood supply, they will grow like normal hair. So you can see the difference between a scalp hair and a beard hair. Like I mentioned, for any hair growth, the importance is not the shaft. It is the peripapillary, that is the white tissue that is surrounding the shaft or the hair that is you see outside, is the one that gives rise to hair. So unless that is harvested without damage, the hair will not grow. So there's always a question, will I see any mark? You don't see. For initial 2 weeks you will see the wound from the extracted grafts, but once it heals you hardly see. So I've done, there are other videos which tells you about the principles of hair transplant, different techniques, where does each center differ in the way hair transplant is done. If you have not watched them, please watch those videos if you're planning to undergo any hair transplant. And if you've had hair transplant before and you still have some questions, I'll be happy to answer them as well. So hair transplant is not a treatment for hair loss. It is a treatment for hair restoration in a bald area. Many people think that they are losing hair so they will get hair transplant done. You will have to take medication to control hair loss, and even the transplanted hair, to prevent miniaturization, you may have to be on some maintenance. So you can see the beard grafts. So the black shaft that you see, that does not have life. The white tissue that you see around it, that is what gives rise to the shaft. So while harvesting, you need to harvest that carefully. If that is not harvested carefully, or the bulb here you see this, if it's damaged, then the hair doesn't grow.
So hello everyone, this is Dr. Anish. So in the morning you saw the harvest of grafts. Now we are going to begin the implantation, and we'll usually start with the hairline, and typically we start from the temporal angle, make sure that we give the appropriate density there, and then we fill the sideburns, and then we come to the central tuft. So he is a patient with grade 7, and the plan is, depending on how much maximum grafts we can safely harvest from his scalp as well as beard, the plan is to get at least 3500 grafts. So because we are limited by the amount of grafts that we have, we'll have to carefully plan how much spacing we are going to give and at what angulation the hair we are going to implant, because usually along the hairline the angulation is somewhere very acute, somewhere close to 5, 10, or max to max 15-20 degrees. But when the amount of grafts are less and we need to give the patient the volume that he desires, we keep it at a slightly more obtuse angle. So probably we'll implant it at 35 to 40 degree angle to make sure that the hair can be combed in an upright position, and that will give you an impression of having volume despite the density being slightly less. So we follow what is called a stick and place method, which is contrary to other where slit and place or DHI techniques. In this we use a needle to basically create a small hole, and through which the grafts are implanted onto the scalp. Along the hairline, it's important, as you can see, the marking has been done in an irregular fashion. So that is what we call it as a micro irregularities. And on top of these micro irregularities, we'll also give them micro irregularities. We'll implant a few hairs in a random pattern to make sure that the hairline is as natural as possible. When we implant the grafts have to completely be sent inside. Otherwise, if the grafts are jutting out a little bit, there is a chance that there may be some amount of cobblestoning that happen. Although our team does prepare the grafts before we implant, so that there are not many, or as much as possible the least amount of epidermal component present along the grafts, so that the chances of cobblestoning are kept to the minimal. And when we implant, we also have to make sure that the bulge of the hair goes beneath the epidermis so that the chance of stem cell as well as the hair survival is better. So usually along the hairline, where we have to create the feathering effect or the natural hairline, we usually always prefer putting only single grafts in the front, probably for half or 1 centimeter, probably 3-4 rows, and subsequently to get or achieve more density, you can start adding double grafts or triple grafts to get the desired density along the temporal angles. So why is it important that a hair transplant has to be done by an experienced person is that we have noticed a lot of times that patients after having done hair transplant elsewhere, they have this appearance of a Barbie doll appearance wherein the grafts, instead of being placed at an acute angle, is placed at slightly obtuse or right angle. So when they comb their hair, you don't see the root of the hair, instead you see the hair from the sides. So you see all the hair standing vertically rather than falling naturally in the front. So it's important that you make sure you discuss who the transplant surgeon is going to be, what are his credentials, what is his experience, what are the safety that is present at the center before considering or choosing the place where you want to do a hair transplant. So when we implant, as I already told, how important is it to maintain the angulation of the hair. Another important thing is to maintain the direction of the hair. So as we move along from the temporal angle towards the central tuft or the midline, you have to notice how the pattern of hair is for a particular given patient. So in this patient, if you notice, the hair falls vertically down from the sides, and as we go along, the hair starts to move towards the midline or pointing towards the midline. So that is what you have to try to replicate. The hairs along the temporal angles are going to be like this, and as you approach here, they will gradually tend to go towards the front. So compared to a slit and place method where the incisions are either made with a blade or even sapphire, in a stick and place method, the advantage is that the scars are very minimal, so it helps to make sure that the healing is faster, and also there are not visible scars in the front or elsewhere because of the use of needles. So before we discussed a few important points to achieve a natural result. One was the designing of the hairline with its macro and micro irregularities. Then was the direction of the hair that we need to place. Then how the angulation should be. So one of other important factors that we didn't mention previously was the density. So to get a desired density, we usually try to achieve somewhere close to 30 to 40 grams per centimeter square. Obviously, it also depends on what is the grade of alopecia and how the donor area is. Depending on that, if the patient is suppose probably grade 2, grade 3 and the requirement for grafts is not much, then we can achieve a higher density. So we can even pack around 40 to 50 grafts per centimeter square. But in this case, if the patient has grade 4, grade 5 or grade 6 kind of androgenic alopecia, then we have to have the compromise between the density that we want and the area of scalp that we need to cover. So in this case, because the area to be covered is much higher, we will not be packing it as we would in a patient with probably grade 3 or grade 2. So we'll be continuing this process of hair transplantation till we finish the grafts. We'll slowly start completing, and probably it will take us another 4 or 5 hours to complete around 3,500 grafts, the implantation process. As you can all see, the patient is comfortable right now, doesn't have any pain, and his vitals are being monitored throughout the process. And once the process of implantation is done, patient will be shifted back to his room. He can have a cup of tea or something, and then he'll be good to go. We'll give him all the necessary instructions that he needs to follow after the procedure. He'll come for a few regular wash-ups after the procedure, and then subsequently we'll give him all the necessary care that he needs to follow at his home.